Let's talk about pre-hospital cricothyrotomy because there's a new paper out that was published in Chest Journal on pre-hospital cricothyrotomy. But first, let's establish what a cricothyrotomy is. A cricothyrotomy is when you establish an airway through the cricoid cartilage because of some sort of airway obstruction or inability to establish an airway. And you can have a surgical cricothyrotomy or you can have a needle cricothyrotomy. The difference between a surgical cricothyrotomy and a needle cricothyrotomy is that a surgical cricothyrotomy is something that we do to make the patient feel better, and a needle cricothyrotomy is something that we do to make ourselves feel better. I'll get back to that at the end of the video. What they did in this paper was they searched through 20 years of data in NEMSIS, which is the National Emergency Medical Services Information System. Your data from your PCR goes to NEMSIS, so it's a pretty comprehensive database. Out of almost 60 million EMS activations, they identified just over 1,100 activations that involved the pre-hospital cricothyrotomy. Most of the patients that received a pre-hospital cricothyrotomy were male. Most of them were under the age of 60, and about half of them were in cardiac arrest when they received the cricothyrotomy. The most common dispatch reasons were cardiac arrest, traffic accident, and stabbing GSW. And 3/4 of the patients who received a cricothyrotomy were actually transported. The overall success rate for pre-hospital cricothyrotomy was around 83%. That didn't change when you broke it up among subgroups, and it's worth noting that that's actually higher than the national average for pre-hospital endotracheal intubation, which is around 76%. That's not good. Now, this is what I want to say about needle cricothyrotomy, which is when you insert an IV catheter into the cricoid cartilage and attempt to ventilate through that. You may think that this is a safer option for your service or your region or your state, but the fact of the matter is that needle cricothyrotomies actually have lower success rates than surgical cricothyrotomies, around 66% compared to somewhere between 83 and 90% depending on the data set that you're reading. It also is associated with higher complication rates, and it is undoubtedly less effective than surgical cricothyrotomy, younger pediatrics notwithstanding. This is why I say that surgical cricothyrotomy is something that we do to make the patients feel better, and needle cricothyrotomy is something that we do to make ourselves feel better. All links in my bio.